right, this is Dr. Moss. Welcome to our Functional Health Kickstart test introduction. The whole purpose of this is to really help introduce a new service that we're offering to our patients here at the office. I've had a lot of patients over the past few years go to functional medicine doctors because they were tired of getting no answers from their doctors, and I appreciate that, but I wanted to be able to bring that in-house and actually provide this to my patients. So what we're going to do tonight is talk about what's the difference between your typical medical testing versus functional health testing. We're going to go over the cause of chronic disease, and then I'll tell you the whole process of how to get the test, what is the test for, and the costs involved. All right, so I got to start off by giving you some background as to why I'm even doing this. Chronic disease in America is through the roof. 6 in 10 adults in the United States have one chronic disease, and 4 in 10 have 2 or more chronic diseases. This is not good because this is not a genetic change over the past 100 years. This is 100% lifestyle induced. So the good news is if we lifestyle our way into a problem, we can also lifestyle our way out of a problem. Now, if you came to our makeover, it was not this past year, but the year before, which was our Pure Energy Makeover. I talked about Dr. Casey Means, who wrote a book called Good Energy. And it was one of the best books I've ever read about the cause of chronic disease and dysfunction in the body. It's written by a medical doctor, which I was super impressed because she really lined up with a lot of things that we talk about here in my office and the Max Living offices across the United States. Now, one of the big things was they all have the same cause, and that is the fact that our body is not producing the proper amount of energy. So I'm going to go through a little bit of the science about the causes of these diseases so that when I talk about what we're testing for, it makes a little bit more sense. So we're going to start off by a little health class demonstration about how our body is organized. So if you look here, you'll see at the top left, you'll see organelles, which is like your mitochondria, your nucleus, endoplasmic reticulum, all the things you've probably totally forgot about because you didn't want to know from 7th grade health and biology class. But those organelles are what make up our cells. And we have over 70 trillion cells that make up our body. And cells are actually organized into tissues, whether it's a muscle or skin or gland, but these tissues will then be organized into what are called organs. Your organs are part of organ systems, and your organ systems make up your organism or the human body. And the reason why I want to tell you this is because when you look at chronic diseases, they all actually have the same source. So we start at the bottom at the smallest part of our body, which are the organelles. If we live an unhealthy lifestyle, we don't eat well, we eat a lot of processed foods, we don't move our body, we don't get adjusted, we don't get enough oxygen, we have too much stress in our life, that unhealthy lifestyle will actually affect the organelles, especially the mitochondria, which is the powerhouse of our cells. It affects those, so it does not function very well, which causes us to be underpowered. If that happens, our cells cannot make enough energy to do their job. That's called bad energy. And when we have bad energy in our cells, now we're going to have abnormal tissue and inflammation in our tissues, which will then lead to organ dysfunction. And if your organs are dysfunctioning, now you're going to have things like heart disease, cancer, diabetes, Alzheimer's, which will then lead to symptoms like high blood pressure, high blood sugar, and even pain. And it's usually not until we have these symptoms that we're taught to go see the doctor. The doctor will run all kinds of tests to figure out what medication is going to fix these symptoms. But as we know, medications don't fix symptoms. They really merely mask the symptoms. So instead of starting at the very top of the hierarchy, which is treating the symptoms of the organism, if we go back and look from right to left here, and you go back to the simplest part of our body, which are the organelles, if our organelles are not healthy, it's because of our lifestyle. We can lifestyle our way back into health. And when we fix those things, everything to the right of that, the cells make better energy, the inflammation goes away, the organs start to function better, the processes stop, and your body will feel and function and be healthy again. So where do we really need to focus? Not the very end. We got to start in the beginning of the process of disease, which is the organelles. Now, I've been talking about the mitochondria. Just as a reminder, the mitochondria is what makes energy in every single cell in your body. Every single cell has mitochondria. Some have more than others, but the purpose of mitochondria is to convert sugar and oxygen into what's called ATP, and ATP is pure energy. Your body uses it, recycles it, and makes it again over and over and over. And again, if your body's making a good amount of energy, the cells are making the proper amount of energy, the cells can do their job properly, and you would not have chronic diseases or dysfunction. The problem is when it doesn't. Now, what causes bad energy? There are 3 causes of bad energy. This is what we talked about at the Pure Energy Makeover. You have chronic inflammation, oxidative stress, and mitochondrial dysfunction. So I'm briefly going to go into the causes of all these 3, what they actually mean. So again, when we get to the testing, it'll make more sense. So again, the mitochondria is like a generator in your body. So I love to use this analogy because to me, it makes a lot of sense. If we have a hurricane coming and we're probably going to lose our power, it'd be a good idea to get a generator. If I was to go to Home Depot or Lowe's and buy a brand new generator and put gasoline in it and start it up, it's not going to be extremely loud because it's brand new. It's all lubricated. Everything's clean. And it's going to produce a good amount of energy. But yes, you're still going to have some fumes. You might have a little bit of mess coming from it because it's still a combustion that's making the energy. Our mitochondria do the same thing. The fuel for mitochondria is sugar and oxygen. And when it's functioning properly, as you can see on the left side, it produces lots of energy as ATP, but it's still going to produce some free radicals. And free radicals are harmful to our entire body. But as long as you have antioxidants to neutralize the free radicals, no problem. So again, free radicals are part of life, but as long as it's in balance, we're good. But what would happen if hurricane's coming? I'm like, I have a generator, but I haven't used it in 20 years because it's been sitting in my shed out back. And, I go out there and I dust it off. I throw some gasoline in there and I start it up. Do you think it's going to be as quiet and as clean burning and produce as much energy as that brand new one? Probably not. But it might still produce the energy, but it's probably going to put off a lot more fumes, maybe make a bigger mess because it's not clean, it's not brand new. So on the right side, you see what's called mitochondrial dysfunction. It's still getting fuel, but it's not as efficient in making the energy. So it produces little or less energy, but it's actually going to throw off and produce a lot more harmful free radicals. And when those free radicals come out, it damages the mitochondria even more, it damages organelles, damages your cells, and then starts the whole chronic disease process. So what are the effects of mitochondrial dysfunction? Mitochondrial dysfunction has been known to show and cause migraine headaches, cardiovascular disease, chronic fatigue syndrome, metabolic syndrome, specific types of cancer, fibromyalgia, Alzheimer's and Parkinson's, which are neurodegenerative diseases, autoimmune disorders, and even autism. So a properly functioning mitochondria is essential for good health. So there's your mitochondrial dysfunction. What's the next one is oxidative stress. So all of our cells are everything in the world is made of atoms, and your atoms have positive protons and electrons, and they're supposed to have the right amount. A free radical doesn't have the proper amount of electrons, which makes it radical, which makes it crazy and causing damage. And what does it do? It'll steal, as you can see, it's stealing an electron from a healthy atom, making it a free radical also. What do antioxidants do? You've probably heard of antioxidants. You probably know they're good for you, but have no idea what they do or why they are good for you. What an antioxidant does, it has an extra electron that it's willing to lend to a free radical to calm it back down to a healthy atom. So basically what an antioxidant does, it neutralizes a free radical to prevent it from causing further damage. Again, free radicals are a part of life. We want to get antioxidants in our body to neutralize as many free radicals as possible. And when you have enough antioxidants to balance out the amount of free radicals, you have what's called homeostasis, proper health, things are functioning properly. The problem lies when we have too many free radicals and not enough antioxidants. When that happens, now we are having a raging forest fire of free radicals damaging cells, damaging organelles, damaging your DNA, causing things like cancer. Now, you've seen oxidative stress, you just didn't know what it was called. If you have a tomato at home, you let it sit out for too long, it starts to rot. That rotting is oxygenation, oxidative stress, and you see it rotting in front of you. when you have a normal cell in your body and it becomes attacked by free radicals, that cell becomes damaged as oxidative stress and can no longer function properly. Now, what causes oxidative stress? You'll see things like air pollution, GMOs and pesticides. So lots of toxins, alcohol, smoking, drugs and medication, toxins in your water, but inflammation can cause it. Processed foods can cause it. Disruption to your circadian rhythm, not getting proper amounts of sleep can cause it. A sedentary lifestyle can cause it, and chronic stress. Now, what are some factors that can actually cause the inflammation? Like I said, eating inflammatory foods, blood sugar imbalances, leaky gut syndrome can actually cause chronic inflammation. Chronic stress leads to chronic inflammation. Poor posture and breathing patterns, chronic infections, environmental toxins, and poor sleep habits. These are all leading towards the third cause of bad energy, which is chronic inflammation. And inflammation really is the basis of all disease. So if we get rid of chronic inflammation, because again, inflammation, acute, you sprain your ankle, it swells up, that's a good thing. Don't get in the way. That's your body's natural response to an injury. But when it's there for 48 hours or longer, or for years, because of these issues, continuously eating inflammatory foods or chronic stress or poor breathing habits or toxic environment, that's going to lead to chronic inflammation. And what does that cause? Memory loss, brain fog, and cognitive decline. Loss of muscle tone, weight gain, damaged blood vessels like cardiovascular disease, abnormal cell growth, also called cancer, a damaged gut lining, which will lead to food sensitivities and autoimmune diseases, joint pain, and accelerated aging. This is all caused by lifestyle choices that you may or may not have had any idea were actually causing you to lose your health. So what are most people doing when they have lost their health and they're not feeling well? What they do is they go to their medical doctor and they get blood tests. I've even had patients say, I went to a doctor and had all these tests done, 150, 200 markers tested. Can you look at it for me? I look at it, and it's not really telling me much other than whether you already have a disease or you don't, because these blood tests are typically designed to diagnose a disease that's already there. It's not telling you what direction you're going. It doesn't tell you if you're building health or disease. It doesn't show you if you're susceptible or vulnerable to a disease in the future. It just tells you if you have a problem now or not. And unfortunately, you have wide ranges of what are called normal ranges. And if you look closely there, you'll see two little L's and an H. So your doctor typically will run through their list and see the L's and say, oh, these two things are out of range. Well, ranges are huge. And there is an optimal range, and then there's a normal range within normal limits, and then there's out of normal. The only things that are flagged on these tests are things that are out of normal, not what's in the optimal range. So these are not really the best tests to show you, are you building health or are you building disease? And I know I hear this all the time from my patients. I don't feel good. I'm weight loss resistant. I'm tired all the time. I'm cold all the time. What are those signs of? Hypothyroidism. And I say, you have a thyroid issue. Well, I just went to my doctor and I had all the tests done and they said I'm normal. Think about that. People can have A-OK blood tests and still be deficient in many micronutrients, suffering from inflammation, a bad thyroid gland, an unhealthy microbiome, prediabetes, accelerated aging. But the problem is that blood tests often only show you a crude, limited snapshot of our health. Your body is not healing. Just because the blood tests come back and say that everything's fine doesn't mean it's fine. It just tells me that blood test is not checking the right things. So if you have any of the issues that are above the water on this slide, frequent colds and frequent infections, fibromyalgia, brain fog, allergies, mood swings, bloating, autoimmune diseases like Hashimoto's, type 1 diabetes, psoriasis, skin issues like psoriasis and eczema, poor concentration, issues with your sleep, weight loss resistance, chronic fatigue, digestive issues, or just about anything else, we can't just go take a medication to fix those symptoms. We need to look at the root cause of all these problems. The root cause, if you look on the left side of this iceberg, underneath, as you know, only 1/8 of the iceberg is going to be above water, 7/8 are going to be below. We got to look below the water. What is causing it to pop up out of the water in the first place? And the three on the left are the three we just talked about that Casey Means talks about, which is oxidative stress, chronic inflammation, and mitochondrial dysfunction. But there are a few other ones that we are going to be testing for that can also cause these things on the left, which can lead to the things above, like leaky gut syndrome, microbiome dysbiosis, which means an imbalance of the good and bad bacteria in your gut, immune dysfunction, and broken detoxification pathways. So if you're experiencing any of these issues, even though you're eating healthy, you're exercising, you have great stress management habits, you're getting adjusted, functional testing can offer you valuable insights. So what is functional health testing? It can actually help identify dysfunction before disease. It's used to diagnose functional imbalances and deficiencies. It looks for the root cause of chronic illnesses, and it will actually identify health vulnerabilities. Functional testing doesn't just tell you what's wrong. It provides data-driven guidance on how to restore proper balance to your body. So what we're going to do now is, for the rest of this, we're going to go through what are the tests, what are we testing for. So this is what the test kit looks like. I'm going to talk a bit more about this in a few minutes, but it's something that you'll take home. It's a blood test that a little pinprick on your finger, a urine test, and a saliva test. You get all these done. You put them back in the box. You send it off to the lab, and we get the results within 14 or so business days. And then we sit down and go over your results. So what are we actually testing for? The first thing we're going to be testing for is something called zonulin. Zonulin determines your gut permeability. Now, if you've ever been to any of our gut workshops before, I've explained this to you before. Your gut starts here at the top and goes all the way to the bottom where everything else comes out. If you think of it as a hose, it's one hose that starts from the mouth, goes all the way to your bottom. So when you eat food, the food really just stays in that tube until it comes out at the other end. So the food that you're eating is actually never actually inside your body. It stays inside this tube. Now the tube, different things happen. It digests the food, it breaks it down, then it assimilates and brings in the nutrients. But you have what are called gap junctions when you get to your intestines. The gap junctions, your cells should have nice tight gap junctions. And when food passes through, they open up a little bit to allow nutrients and minerals and micronutrients and all the things and vitamins to actually go from the tube, your hose, your digestive system, into your bloodstream. That's how we absorb and what's called assimilate nutrients. However, if zonulin is high, which it should not be, what you get is swelling, and your gap junctions, which are these junctions between the cells, actually swell and open up. And when they open up too much, things can get through that should not get through, like pieces of protein. So if you eat meat, pieces of the meat can actually go into your bloodstream, and that's called leaky gut syndrome. Now, when your gut is leaky, allowing things that should not go through into your bloodstream, it can cause all kinds of autoimmune diseases, because now your body is recognizing muscle tissue, maybe from a cow or a chicken or fish, but it's in your bloodstream and your body's going to attack it. And if it's constantly attacking it, it might actually start attacking your body because it's learned that this is not supposed to be there. This is how autoimmune diseases start. Typically, it starts in your gut. So it determines, like I said, your gut permeability, your gap junctions, and gut dysbiosis. So again, your imbalance of your digestive system. And if your high zonulin levels are high, that means that you do have leaky gut. You have an immune activation because of it, and that can lead to things like fatigue, brain fog, food sensitivities, joint inflammation, skin issues, and autoimmune diseases like type 1 diabetes, Crohn's disease, Hashimoto's. I can go on and on, psoriasis. These are all due to leaky gut. So this is a very important marker. The next marker we look at is LPS, which stands for lipopolysaccharide. And lipopolysaccharides are supposed to only be in your gut and nowhere else. However, if it's found in your blood, it signals that your gut barrier has been compromised and a immune system reaction has been triggered and you have inflammation. So this tells me that there's a leak, in your gut, there's inflammation risk, and your immune system has been overtaxed. Now, as you can see here, there's a range of good, but then there's a high and a low. Those mean two different things. If it's high, that means your gut barrier is leaking and you're at very high inflammation risk. If it's low, that means your immune system has been overtaxed so long that it's no longer mounting a strong response to a low-grade microbial stress. So whether it's high or low, you can have fatigue, brain fog, joint pain, autoimmunity, gut issues, and immune system weakness. So look, what I'm showing you here, this is very interesting. If you went to your doctor and your white blood cells were normal, they're going to say you're not fighting anything, you're fine. But if I see it here, that tells me it's coming. These tests can actually show you which direction you're going. Are you prone to have these problems? Let's fix it before we have a major issue. The next thing we're going to look at is something called secretory immunoglobulin A, or SIGA. It's a lot easier to say. And this is actually the main immune antibody that protects the lining of your gut and your lungs from pathogens and toxins. And this, again, can be high or low, and it can either show me that you have an overactive immune response constantly being taxed, or you can have a weakened immune response from stress, and it can also tell us if your adrenals are fatigued. Now, if it's high, again, you have a response from an infection, it's active, and it can lead to dysbiosis and irritable bowel disorder, gut irritation and food sensitivities, adrenal fatigue. And if it's low, that tells me your immune system is compromised, which is going to increase your susceptibility to infection. So if you're somebody who's quote unquote always getting sick, even though you're getting adjusted, you're doing all the things you're supposed to be doing, your SIGA is probably low and it needs to be corrected. The next thing we're looking at is what's called F2 isoprostane. And this is a measure of oxidative stress. So again, oxidative stress can lead to cancer. And what this is really doing is telling me, how are your cell membranes doing? How healthy are your cell membranes? Because every membrane of every cell in the 75 trillion cells you have in your body is made of fat. It's called a phospholipid bilayer, 2 layers of fat. This test can tell me, how are your cells doing? Are they healthy and passing information and nutrients back and forth? Or are they becoming oxidized? Are they becoming damaged? It's also going to tell us, if you have oxidative stress, that means you need more antioxidants and you could be out of balance, and that's going to lead to more problems. What are those problems? Fatigue, poor recovery, somebody who does get sick and then takes months to get better. Cardiovascular disease, cognitive decline like Alzheimer's, and depression. It can also lead to things like Huntington's, cancer, generalized pain, inflammation, and generalized pain and inflammation in the body. So we need this to be on the lower end. 8-OHDG, or 8-hydroxy-2-deoxyguanosine. Yeah, the 8-OHDG is almost as hard to say as all that. What this is showing is oxidative damage to your DNA. And if your DNA is damaged, your body's going to keep reproducing cells that are damaged. Okay, this is not good. This tells me if it's chronically elevated, increased oxidative stress, which leads to cancer, accelerated aging. Have you ever seen somebody who's 45, they look 70? That's accelerated aging. It can lead to things like depression, fatigue, diabetes, and neurodegenerative diseases like Alzheimer's. So again, this doesn't tell you already have it. This is telling you you're building it and at risk. So again, if you have a high 8-OHDG, what does that mean? You probably are tired a lot, brain fog, cognitive decline, forgetting things a lot, chronic inflammation, cancer, and accelerated aging. Now, these last two are related. They are going to talk about glutathione. And if you've been to my workshops before, I've talked about glutathione. It is the master antioxidant for detoxification and for your immune system. Glutathione is something that we want more of for sure, because it's going to help neutralize oxidative stress. And when I tell people, make sure you're taking NAC, the reason why NAC is so important, NAC is the precursor to glutathione. So when you take NAC, when you're not feeling well, what are you really doing? You're producing more glutathione, more antioxidants, and helping your liver detoxify so that your body's immune system can function at its tip-top shape. So your total glutathione tells us, what are your reserves? How much glutathione do you have in your body? Because if it's low, that means your antioxidant reserves are low. That means your body's the efficiency of detoxification and your immune defense is going to be lowered as well. So we want that to be high. But somebody who has low glutathione could probably fight an infection for a little while, but it might run out pretty quickly. Or maybe you've gotten hit with two things at once and just hit the wall and can't get out of bed. That's because your glutathione levels are too low. So when that happens, you're going to have chronic illnesses, fatigue, anxiety, and then, of course, increased oxidative stress because of the lack of antioxidants. But the other one that we're testing for your liver, again, I'm not telling you about your liver enzymes because your liver enzymes can be normal and your glutathione levels could be low. Again, that's not telling me the whole picture. I want to know not just the state of your liver. I want to know how well is your liver functioning and how efficient is it detoxifying. So reduced glutathione means active glutathione. How much glutathione is activated right now in your body, floating around and working? So basically reflects your body's ability to maintain antioxidant balance. And we want that to be high because it's going to help remove damaging free radicals from your brain, your liver, your lungs. And if it's low, it's going to be difficult for your mitochondria to make cellular energy, which means you're going to have bad energy. Underpowered cells lead to chronic disease. We do not want oxidative stress. We do not want a higher toxic burden. So we want to make sure our reduced or active glutathione is high. Because if it's not, again, a lot of these are overlapping symptoms. They all sound very similar, but they're all signs of bad energy in our body. Fatigue, slow recovery, chemical sensitivity, brain fog, and signs of aging or accelerated aging. So as you can see, the 7 markers that we're testing, I thought when I first learned about this test and I got trained on it, it was like only 7 things, but these 7 things are powerful. They are going deep into the root cause of most issues that people are dealing with. So again, what do we do about this once we have it? What we do is we'll have you come in, we do the test. This is, again, what the test looks like. We'll send this off. You send it off at UPS. It's already prepaid. We get it back in 14 days. We sit down, and then what we'll do is, based on your particular results, we're going to put together a care plan. That care plan can include different ways of eating and different diets, whether it's a SIBO diet, anti-inflammatory diet, the advanced plan. We'll figure out what the best option is for you. And then we're probably going to have some supplements ready for you and a care plan to help restore the deficiencies and the issues that you're dealing with. And then we can retest in between 4, 5, and 6 months. And that really depends on the severity of the case, the severity of the symptoms, how many markers were off for you. But I can tell you right now, the supplements that we have, I truly believe are the healthiest and the best on the entire planet because they are from a regenerative organic farm, which is going to not only be great for a healthier planet, but also we're maximizing nutrient density and ingredient potency and absorbability. And in this picture here, you can see me with Jordan Rubin, who he created Ancient Nutrition. He created Garden of Life supplements, and now he's helped us with our Pure Path. Pure Path is Max Living's brand. They are all sourced from his farm. He has 2 farms, one in Nashville and one in Missouri. This is the one in Nashville. I got to see all the regenerative organic processes. Amazing stuff. He takes so much pride in what he's doing, not just to create the best supplements on the planet, but also to help Earth get healthy every single year. That's what regenerative is all about. Regenerative organic makes that land healthier every single year. So when we're creating supplement plans for you, we're going to be utilizing the main 2 brands, which are Pure Path, which is the Max Living brand, and then Josh Axe and Jordan Rubin and Max Living partnered together to create Kingdom Health Sciences. This is a brand new brand. You've probably seen it in my office. We have a couple, I think there's 10 or 12 SKUs that just came out. And the whole purpose of this is to, again, create the regenerative organic culture. But Jordan's vision for this is to take over the functional health medicine realm with these particular supplements because they're better for the world, they're better for the earth, but they are the most absorbable and most potent supplements on the market. And there's going to be more and more coming out. So we're going to be utilizing this, and this is only for practitioners. You can't go to the store and buy this anywhere. It can only be purchased at a functional health practitioner, which we are now going to be practicing. So I'm very excited to be able to provide this for my patients. So again, what does the process look like? Start by getting the test. Do the test at home. If you need help with it, we're welcome to help you with it. But the test kit has everything that you need inside of it. It has everything you need to prick your finger, pee in a cup, saliva test, all things. And it also has instructions. And these instructions are extremely clear. I've done tests like this before. I was confused and I had to read them 20 times to figure out the order. These instructions are extremely clear on how to do the testing. If you do need help or you just don't want to prick your own finger, we'd be glad to help you with that. That's up to you. But you send the results in. Like I said, it's a UPS prepaid. Drop it off next door to my office. Within 14 days, we'll get the results back, and we'll set up a special appointment time to sit down with you. It's probably about a 30-minute appointment. It won't be during our typical hours, but we're going to set up a special appointment to sit down and review your test results with you. At that point, I'll already have a care plan ready for you that we have. I have consulted with 2 other doctors, which is really cool to have on our staff. One works directly for Max Living. She's a functional health provider. So she knows everything about everything. And then we also have a naturopath who's a world-renowned naturopath that works for an integrative office called Progressive Medical in Sandy Springs, which is the lab we're using. So both of those doctors are working with me to evaluate every single one of my cases and help create care plans for them. So the care plan will probably, like I said, have some dietary changes, and then it will have supplements. And sometimes supplements are only for 2 weeks, and then a different supplement for 2 weeks, and a different supplement for 4 months. Every case I've seen so far has needed something different. So we'll create the best care plan for you. We have options on how to take care of the cost. And then at the end of the 4, 5, or 6 months care plan, we would recommend a retest to see what results we've gotten and see where we are. Now, you're probably wondering, what does this cost? The cost of the test is $399, but we are doing it for $329 for until May 4th as an introductory price to my practice. You can do it for as many people in your family as you like. There's no limit, but it is $329 until May 4th, and then it will go up to $399. When you do a retest, we do give you a discount. It's only $299 for your retest. And just for your instructions, there are 2 sheets that we're going to be giving you. This sheet right here is basically an order form for me to find out, why do you want the test? What do you want to get out of the test? What issues are you dealing with? So I have a baseline on what we can use to figure out how to help you. And then very important, this test, this sheet right here is your requisition form. This is in every single one of the tests. You need to make sure you fill out anything that's been highlighted in yellow and make sure you put it into the box when you send it. Otherwise, they're not going to know who ordered it and where to send the results, and they're going to charge a card, and you don't want to have that done. So if you guys have any questions for me, we'd be glad to answer any of those questions. But I'm excited for you guys. I'm excited for my practice. I'm excited to be able to finally provide a new service that I think is going to be a game changer for my patients, my staff, and my community. So again, if you have any questions, feel free to reach out. But I hope you guys get this test, and I can't wait to see what kind of results we can get for you.